Okay, I think we can commence. I'd like to thank everybody who made the time this morning to be with us. For this episode of Ask the Experts, which is a production of the Namibia Media Trust. My name is Frederico Links. I am the editor of Namibia Fact Check, and this is Ask the Experts is about hearing from health and medical experts about the COVID-19 situation as it impacts Namibia. And this is about, Ask the Experts is also about giving an opportunity, a platform to the media who might have questions that they feel are not being answered in other platforms, to then try and get some answers through Ask the Experts as well. This is our third session. So for this session of Ask the Experts, which is just an hour long from 11 to 12 o'clock, we have with us the Ministry of Health and Social Services, which is at the front line of Namibia's COVID-19 response. Mr. Nangombe, thank you very much for joining us and making time for us today. To please just introduce your colleagues who will be dealing with the questions that should be coming through from the media and those interested and watching.
Yeah, good morning, everyone. Chair, can you hear me? Thank you very much. My name is Ben Nangombe. I am the Executive Director in the Ministry of Health and Social Services. First of all, before I introduce my team, I would like to commend the Namibia Media Trust for hosting this session of Ask the Experts. This is important because only when we have factual information can we, and by that I mean the media, can the media inform the public correctly and factually. And this is important because in the earlier days of the pandemic, we saw high degrees of fake news, which some ended up referring to as an infodemic of false information. We are happy to be here this morning so that the journalists can hear it from the proverbial horse's mouth. I am informed that today's topic will deal with, among other issues, about whether we are likely to face a second wave of the COVID-19 pandemic in our country. And our experts are going to speak to that issue. I want to introduce my team and yield back to the chair. And I would wish, nonetheless, to be given another chance to just officially state our position, or rather just give preliminary remarks before the experts can then come in. This morning, in my office here, I am accompanied by Dr. Theoben Kandetu. He is the head of case management for COVID-19 in the ministry. There's a director for primary health care, also playing an important role in the COVID-19 response, Madam Naomi Shopala. I'm also your good friend Manga, the PRO, is here. I'm sure you've been in touch with her over the past few weeks. We also have other experts from the ministry joining us online from elsewhere. I think Ms. Mataranyika is online, is she? and a few other officials from the ministry who are joining virtually. So that is our team. And as I said, I yield back to you. And if it pleases you, I would want you to, after you have introduced your team, for me to make some sort of opening or preliminary remarks before we get into the discussion. Thank you very much, Rodrigo.
Mr. Nangombe, yeah. So the team here from, I see there are some, I think some media people here from NMH, Ms. Lamprecht, and then there are colleagues from the Namibia Media Trust. Yes, I would like you to go ahead, please, with your comment that you wish to make at this point, and then we'll just jump straight into the questions as we've received them. Some of them have been sent to me, and I'll put them to you. And then, of course, I mean, it's up to you who will be responding to these questions. But I think also in the past, we just ask the participants to state their questions directly to the experts. So I hand it back to you, Mr. Nangombe.
Thank you very much, Rodrigo. As I said, I understand that one of the main questions that we want to grapple with this morning is whether Namibia is likely to experience the second wave of the COVID-19 pandemic. But of course, as you indicated, there may be other questions either related to or independent from this particular question. As I said, I have experts here, but by way of background is just to say that, you know, to answer the question whether we are going to experience a second wave, we need to look at the timelines for COVID-19 in Namibia and in other parts of the world. That's what we need to take into account. For Namibia specifically, we are talking about COVID-19, the index cases, the 2 index cases having been reported around the 13th of March, 2020. And if you look at the number of cases per month since then, the total cases, positive cases for COVID-19 in Namibia in March were 11. In April, we had about 5. In June, we had 231. In July, we had 1,968. And then in August, the figure jumped up to 5,468. On the 23rd of August, we had the highest number of cases reported in a single day at 316. In September, we saw a gradual decrease, the cases coming down to 3,681. And further decreases were then recorded again in the month of October. To date, for October, almost midway through the month, we stand at 516. As of the 13th of October, we reported perhaps one of our lowest single day numbers at 11 cases. So that is the context within which we can answer the question as to whether a second wave is going to come or it's not going to come. But we have to take into account other factors as well. So what we have seen is that there are second waves being experienced in other parts of the world, and we cannot be oblivious to that. We also need to take into account the fact that we have since entered into a new normal where we are seeing a gradual opening up of our borders. As you may recall, the first cases that were reported in Namibia were actually imported from outside the country, and that's why we have implemented the measures that we had in terms of the lockdown and the closure of the borders, the closure of the airspace, the closure of our seaports. But we are saying that we must be mindful and alive to the fact that this is an evolving pandemic. It involves a number of many other factors that we need to take into account when dealing with that. So the fact that other countries are currently experiencing second waves can be attributed to a number of factors. Some may have opened up too soon, or the behavior of citizens has been that once they have seen that the cases are going down, people tend to relax their guard. They don't practice hand hygiene, they don't avoid crowds, and so forth. But what we need going forward in order for us to prevent the second wave is, again, to religiously comply with these measures. It has been scientifically proven that face masks do serve to prevent further spreads. Hand hygiene is important. Social distancing is important. Avoiding crowds is important. Of course, whether we are going to experience a second wave or not depends on those factors of practicing hand hygiene, social distancing, and general compliance with the measures in terms of avoiding large crowds and so forth. Second wave is going to be experienced or not depends on whether Namibia achieves what is known as herd immunity. My experts are going to speak to that. And again, whether this herd immunity will be sort of a natural herd immunity or it's a herd immunity that can be introduced. I want to say participating in a safe vaccine once it is has been properly tested and for general use.
If there are, Calvin, if you have any questions, please ask them. We only have the health officials here for another 20 or so, 30 minutes. So if you have anything, please ask them, and then I'll just put some questions to the health officials.
All right, thank you so much, Frederico. So you're saying I can actually ask right now, or is there a point where we have to ask the questions?
No, please just go ahead. Please just go ahead.
That's all right. Thank you so much for inviting us to this very special meeting. The Executive Director of the Health Ministry, Mr. Ben Nangombe. And thank you so much, Frederico, and your team for making this meeting possible. What can speak to the fact that we are likely headed for a second wave? That's the number one thing. And how far are we? How likely is that possibility for a country like Namibia right now, where we are seeing a very exponential improvement as far as our COVID-19 situation is concerned? That's number one. And the second question, Mr. Nangombe, is, are you quite concerned about what's playing out in Europe right now? We're seeing the Britons, they're talking about possibly locking down their economy once again. The Spanish and the Italians, they are protesting there against having to wear masks again. And we're seeing Europe going through another fear of a second wave again. What would be the likely impact of what's happening in Europe on Africa, and particularly here in Namibia, most importantly when it comes to movement and the opening of our borders?
As to the indicators, whether there are indicators that Namibia is going to experience a second wave, we are saying that there is a possibility of a second wave. But our indicators currently seem to be showing that there is a decrease in the number of cases. So if we are seeing a slowdown in the number of cases, it means it is possible that we may avert a second wave. But that can only happen if we continue to comply with the measures. Yeah, so I'm saying that we are looking at a situation where our cases are decreasing on a daily basis. Our statistics indicate that in almost all regions, we are seeing a downward trend. But that is actually a situation where we are, our initial projections were showing that everything else being equal, or without the measures that we have taken, we should have witnessed Dr. Kandedu up to about more than 100,000 cases by the middle of September. That is what our modeling was showing. So that tells us that our measures have worked, and therefore we need to continue to comply with these measures. But that being the case, we must also be mindful of the fact that we are gradually opening up our borders. And with the opening up of our borders, there is a possibility of the importation of these cases. Particularly now, we know that there is a second wave happening in Europe, and as much as travelers may arrive at our ports of entry with negative PCR results, things can change, and we must continue to be careful and be on our guard at all times. And yes, the events that are unfolding in Europe at the moment are of concern to us. Why? Because Europe is the source market, particularly for our tourists. And we are basically at a point where this is the peak season for tourism in Namibia. Our tourists come from those markets: England, Germany, Spain, France, and others. And that is where these second waves are being experienced. So it's of concern to us. And that said, even in terms of trade and commerce, these are also important markets for Namibian products, including our beef, our agricultural products, and so forth. And if those economies become subdued, it means we are not in a position to export to those markets, and that impacts our industry here locally. So it is a point of concern as to what is happening there, because the world is interconnected and Namibia is not an island. I think, Dr. Kandedu, do you want to speak to the question of the indicators, whether we are going to see a second wave, and how you can supplement what I just said? Thanks.
Yeah. Thank you, Edie. I think Edie has really highlighted it very, very well. I don't want to dilute what he has said. I agree 100% with everything that he said. Maybe just to expand on the indicators a little bit. The question that was posed really speaks to a time period when do we think we will experience a second wave? And the matter is, we are not sure. We are not sure because it depends on exactly what Edie Nangombe has highlighted. It depends on the compliance of the public to the public health measures. It depends on us relaxing the current restrictions that has proven to be very, very successful in mitigating the spread of the virus. And the third thing, it also depends on our inevitability sort of opening up our communities, our economies, and so forth, which I'm saying is inevitable because we do depend on largely on industries and sectors like the tourism, like the tourism sectors. So it really just depends. If we are able to adhere to the current restrictions, then we may be able to delay the incidence of a second wave, at least until we have an effective and safe vaccine, as well as an effective vaccination program that is able to target at least 20% of the population, and that would obviously then be the vulnerable population. for us to achieve some sort of immunity. Although, as Edie has already touched on, the verdict on immunity is still out. There is a lot of research that is currently being done. So really, in short, it just depends on those indicators, those factors that we have mentioned. Thank you.
Yeah, no, thanks, Mr. Nangombe. Thanks, Dr. Kandetu. Are there any other questions from any of other participants? All right.
Frederico, maybe in the absence of another person asking, if you can just maybe give me a second opportunity. Executive Director, my name is Kelvin from Eagle FM. Another question coming your way, Executive Director. Are you quite concerned about the crowds that we're beginning to witness? I mean, as the election fever takes its center on Namibians, we saw over the weekend a lot of political parties driving through, showcasing their colors, and we have experienced the 5 days of rage coming from the young protesters protesting against gender-based violence. Media reports have been that they've been numbering between 200 to 400. This is very much of a flagrant contravention of the health regulations. Are you quite concerned about that? Is this a breeding ground of a potential second wave?
Maybe I'll also just add a question there. I think for sort of awareness purposes, Dr. Kandetu, if you could just explain the concept of herd immunity, and then just if you could just spotlight what it was that the World Health Organization, Dr. Tedros, the statement he made yesterday about the unethicalness of chasing herd immunity in some places and making that sort of the primary approach of some authorities in some parts of the world, and he used the term unethical. Could you just firstly explain the concept, and then why the World Health Organization issued that statement yesterday?
Thank you, Frederico. Before Dr. Kandetu speaks, let me address the question by Kelvin regarding the crowds that we have seen gathering for purposes of election campaigns, and then the protests against sexual and gender-based violence. The ministry has thought long and hard about the impact that large crowds would have on the spread of the virus. It is for that reason that after thorough consultations, it was decided that public gatherings should still be limited only to 50 persons, even in the context of us opening up and relaxing further and further. And the reason for that is that it has been, again, I repeat, scientifically proven that large public gatherings have served to be super spreading events. In the moment you have a large crowd of people, and God forbid, you have infected people there. And because Namibia, particularly now the jurisdictions of Walvis Bay, Swakopmund, Arandes, and here in the Commerce region, Vendo, we have seen what has been referred to as clustered community transmission. That is where our concern is. And we don't want to have a situation where our health systems get overwhelmed by an uncontrolled number of cases. So in any event where we see large crowds of people actually contravening the regulations that have been put in place, that is a source of great concern for us, because we know that we can possibly witness and experience new clusters from those types of gatherings. And that is, but at the same time, we are saying we want compliance to be voluntary compliance. As much as the measures are there, the fines are there, the possibility of arrest is there, we are saying Namibians should rather, even during these times of elections or protests because of justifiable incidences that we are seeing, we are still calling upon members of the public to comply, to wear masks, and to socially distance. Because we are saying we don't want to see well-meant events resulting in deaths. We don't want to see that. So political parties, organizers of protests must do so in a manner that does not aid and abate the spread of COVID-19 pandemic in our country. So it is a concern, but we want people to still comply and voluntarily do so. Behave responsibly, because it is your responsibility. Each and every one of us has got a responsibility to ensure that we defeat COVID-19. And we can only do so when each and every one of us behaves in a manner that is desired and that is designed to prevent the spread of the disease. So I yield to Dr. Gabeto to speak about the concept of herd immunity. Thank you very much.
Thank you, Edie. Thank you, Frederico, for your question. So generally, herd immunity is a phenomenon whereby once a specific proportion of the population, of a country's population, has been exposed and infected with the virus or with an inoculum, to mount an immune response against that specific virus, that specific disease, that specific proportion of the population is subsequent to that regarded as immune or protected from future exposures, from future infections, from reinfections. So simply put, that is the concept of immunity. Now, herd immunity is now the specific proportion of the population that we need to inoculate or to expose to become infected, to protect the population from large, widespread outbreaks. Now, why this is unethical, or why it is perceived to be unethical, is because if we embark to achieve herd immunity naturally, that means if we do so without a safe and effective vaccine or a safe and effective vaccination program, we stand to lose a great many lives. And this is an unnecessary loss of lives in the pursuit of herd immunity. So yes, at the end of the day, we would have achieved herd immunity, but there will be a specific proportion of the population that, especially the vulnerable ones, the elderly, the ones with comorbid conditions like diabetes, cancer, heart disease, chronic kidney disease, and the list goes on. These are the ones that are going to succumb to the virus. These are the ones that are going to have a more severe form of the virus and are going to inevitably succumb to the virus in our pursuit for herd immunity. So this is why really it is perceived to be unethical, because in the pursuit, it leads to the loss of lives, particularly the people who are perceived to be vulnerable, as I've mentioned, which is why I think it is not a wise use of our resources, and it's certainly not ethical, as has been mentioned by the Director General of the WHO. It is not correct for us to pursue herd immunity naturally, but we can do so with a safe and effective vaccination program. And this we hope to achieve by the middle of next year.
Yeah, thanks, Doctor. Thanks, Mr. Nangombe. Are there any questions at this stage from anybody else? Please just unmute and ask your question if you have. In the meantime, I'll just ask Mr. Nangombe a question. In the eventuality, say, we take all the steps necessary, people comply and so forth, but we find that unfortunately we cannot stave off a second wave. What is the level of preparedness of the health system at this stage to deal with, because now we're seeing in parts of Europe and parts of the world that actually the second wave is much more intense than the first wave. While the deaths might not be as many as they were in the first wave, the numbers are certainly much higher. For instance, in countries like France, much higher than they were in the first wave, and so there's the expectation that hospitalizations will go up. So we've been up to the stage we've performed relatively well. So in the eventuality, if it does happen that we do experience a second wave, what is the state of the health system with the lessons we've learned up to this point?
You will remember that at the initial stages of our response, we prepared a national costed plan strategy for COVID-19 preparedness and response. And one of the rationales for the initial lockdowns were to enable us to put measures in place in terms of procuring the necessary human resources, procuring the necessary clinical supplies, procuring the necessary high-end medical equipment, procuring the necessary facilities to be able to accommodate persons in terms of quarantine isolation. And then later, also pivoting our policy response so that we deal with the evolving pandemic in terms of ensuring that, for example, while initially we insisted on state-sponsored quarantine, we pivoted our policy to allow for home quarantine, thereby allowing for better comfort of people, but also allowing the state to save money in the process. Pivoting our process in terms of isolation, while we first started insisting on state-sponsored isolation, where people were actually isolated only in hospital settings, regardless of their symptoms and the severity of their cases, we then pivoted that policy to say it is possible to safely quarantine or to safely isolate at home. So that is one other policy response. And also, again, with respect to the isolation or putting aside our health professionals in state-sponsored facilities, we made it possible that we could risk stratify and risk categorize our health workers so that it is not possible to always, for example, withdraw a person who may be possibly infected or exposed to COVID from the way. So these things were done in order to strengthen our health system. But when you look at specifics of these interventions, for example, when it comes to human resources, we have requested the Office of the Prime Minister and the Public Service Commission to allow us to recruit at least 2,605 health professionals in different categories. And that was granted. And we have now recruited more than 3,600 health professionals, if my figures, if my memory serves me right. Some are temporary workers, some are permanent workers, and also additional numbers of volunteers. The data that I saw lately, the highest categories of health workers that we have been able to employ include registered nurses, include, I think it's radiographers and other categories. And this was done in order to strengthen our health system so that we are able to respond correctly and effectively. And again, our policy on providing for the protection of these health workers while they are at work, in terms of providing for a specific algorithm for the utilization of personal protective equipment. So in a way that has helped us to strengthen our health system. We have acquired and procured high-end medical equipment such as ventilators. In the past, in the pre-COVID period, I think in the public in Namibia, we had about only 16, I think a maximum of 16 intensive care unit beds in the whole of the public service. With what we have done through the establishment and construction of prefabricated isolation equipment and the renovation of existing health infrastructure, for example, at the Central Hospital in Windhoek, at Oshagadi Intermediate Hospital, and at Walvis Bay, we now boast are going to have more than, I think, 70 ICU beds in the public service alone. So we have actually strengthened our capacity, we have strengthened our public health system in a manner that we should be able, I think theoretically, to look at this and say, should a second wave come, we are fairly prepared in terms of the capacity of the health system to deal with this. So we are saying that at least in terms of being able to respond to a possible second wave, I think we are standing in a good space. And again, we are saying the only way to avert the second wave is for members of the public to comply with these measures. And I think so far, so good. We are going to strengthen our risk communication and community engagement programs so that members of the public are educated to really comply. And that is what we are saying, and we are going to underscore and underscore that message going forward to make sure that our country does not experience a second wave, and that we are able to, again, the importance of, it's not only a medical issue, it's also the question of protecting the economy and the livelihoods of Namibians. And we can only do that, we can only reopen further if our health systems or our people continue to comply. So that is in a nutshell what we can say about our preparedness to deal with a possible second wave. I think our systems are stronger. We have picked up the necessary experience in terms of managing, because even the management of patients, I can tell you that already now, what we have done is to say, while there was restrictions, for example, on the referring of patients from one level of healthcare to another level, we have now seen that we are able to open up even for elective surgeries and things like that, depending on how our health workers are going to manage these issues. So we must be cognizant of the fact that we don't want to lose the gains that we have made in a number of programs already within the country. And for that reason, it's important to ensure that there is continuity of services. We don't want to see people suffering at the altar of COVID, but those that need the services should be able to get them. And we are already going back to some kind of normalcy in terms of being able to accommodate even those elective cases that needed to be handled. So I think that in terms of preparedness, we have done fairly well, and we hope that we'll be able to deal with anything that comes from here henceforward.
Thank you, Mr. Nangombe. Earlier you mentioned the COVAX facility. Perhaps you could just give us an update of what the developments are within the COVAX context. And Dr. Kandetu said we could expect a vaccine some point mid next year. But what exactly, because there have been some of the vaccine developers, two of them actually, over the last few days have halted their testing of their clinical testing of their prospective vaccines. So what does this mean? And should people really be holding out for a vaccine being the be all and end all that some think it will be? And shouldn't there be a more realistic message being pushed in public about a vaccine than what people are consuming, I think, in a large extent, in the online spaces where they seem to get their information. So perhaps you could just give us an update on COVAX and some of these issues that you see swirling around online.
I have a member of our vaccine task force here, Ms. Naomi Shopala, but before she comes in, I'll just say that yes, Namibia has taken, the cabinet of Namibia, the executive has approved that Namibia participate in the process of the COVAX COVID-19 vaccine facility. That means Namibia having to sign up and complete the commitments that are embedded in this process. That means Namibia having to make a prepayment of a determined amount, depending on the dosages that Namibia would wish to procure for this vaccine. And that process is ongoing. There are specific conditions that need to be met so that Namibia is able to participate. So without going into the details of the exacts of what exactly is going on, suffice it to say that the cabinet has approved that this happened. On the development of the vaccine itself and the clinical trials that are going on, that is a different matter. What the COVAX facility is going to do is to say that any vaccine that is safe, that is being able to be brought on the market, and that should become accessible to countries, that is the vaccine that the COVAX facility is going to make available to countries that have participated in the process. So this is outside of the question whether candidate vaccine A is successful or candidate vaccine B is successful. What we are going to get is that vaccine that is safe and that is brought onto the market. So we want to be in that position to be able to access the vaccine. So I think we need to distinguish between the COVAX proper and what is happening in terms of the manufacturers conducting the human trials. But maybe, Shopala, you can come in here, and also Dr. Landet, if you want to add. But Naomi, can you come in on that one?
Thank you. Thank you for the question, and thank you, Edie, for the update that you have provided. That is really in line with the latest development. Perhaps I can just add also the task force that Edie have just referred to is meeting frequently, and this task force is examining and following all the scientific development and updates related to the vaccine and making the proper recommendation to the ministry in terms of what product to go for once that product has been approved. But I want to emphasize that this is multi-stakeholder task force where we have the academic, we have the virologists from laboratories, and we have scientific public health experts who are meeting on a bi-weekly basis to continue following up on this development. I also wanted to add that the cabinet approval that Edie Nangombe has just referred to has also approved a communication strategy, which was very well detailed, presenting to cabinet that as a country, this is how we are going to go about educating the public and making sure that everybody has got the correct information that they need. As we said, this has just been approved. Now the team has to go back and now start with the preparation for the implementation of this communication strategy, really to ensure that the public understand the importance of the vaccine, that while we can spend and invest in taking care of the people who become infected, equally we need to invest in the vaccine to avert people getting infected. As we have just learned, we have lost about 129 lives. Those are lives could have been saved with the vaccine. And in the long run, this is really a good investment because with the vaccine, we'll be able to open up more and more from the economic side. So those were just my few additions.
Thank you, Mashipala. Perhaps just if there is a timeline on when the communication strategy will be introduced, perhaps if you're able to at this stage reveal this to us, it would be great.
Thank you. I would say the communication strategy implementation has started as of this session for today. Just informing the public of where we are, that we have a strategy for the introduction of the vaccine that has been approved by cabinet, which means our leadership have endorsed us to start with the preparation for introducing the vaccine. And the fact that we are informing the public that there is a communication strategy and we will be reaching out to members of the public to share information on this vaccine. So those are some of the first step. It will be ongoing. I will not be able to share the details in terms of like in next week we are going to do this, but what I can tell you is that the task force is divided into smaller thematic group, and one of the group is just looking into this communication. Now that we have this approval from cabinet, this smaller group on communication will embark upon the implementation of the proposal that has been approved by cabinet. So in short, that is what I can say, but I feel like we have already started.
Thank you for that. Okay.
Federico, I have a question.
Please go ahead. Please go ahead, Shemaine.
All right. Good afternoon or good morning. My name is Shemaine Gashihewe from the Namibian newspaper. I wanted to find out from, I guess, Ms. Shopala in terms of the vaccine. The WHO said last month, September, that Namibia needed to pay a 15% of the estimated cost to partake or to officially be part of the COVAX beneficiaries. Do you know perhaps what the estimated cost is? And then perhaps also of that, has Namibia made that payment? Because the payment needed to be made by end of September, if I'm correct. Thank you.
For your question. Before I go straight to respond responding to your question, I wanted to give a bit of a background. We know that there are several countries here in Africa that are participating in this COVAX facility. Now, most of the country, because of their economic rating and ranking, they can participate in this facility being sponsored by international entities. Namibia, with a few other countries, I think around 8 countries, because of us being ranked highly in terms of our economic status, we have to participate in this facility as a self-financing country, which means we have to pay for all our doses that we are ordering from the COVAX. Now, in terms of how much or what is the estimated cost of this 15% upfront payment, currently we are estimating about in the range of 26 to 29 million Namibian dollar to secure the vaccine, to ensure that once the production begins, we are already lined up to receive this vaccine. We are not going to start from step 0. I think in the previous question we just said we received the approval from cabinet, and by the time we received the approval, the deadline was so close, and we have to make this international payment. There were some processes that we needed to take care of. While the payment has not been made yet, the facility is fully on board and is fully aware of the processes that we are undertaking to ensure that that payment is settled. So in short, that is what I can say.
Yes, just to add that, as you may know, the Gavi Alliance, the COVAX facility are based in Geneva. Namibia is an ambassador accredited to the UN office in Geneva, and that mission, and I'm in contact with our ambassador in Geneva on these matters related to COVAX as well. So we are in constant engagement with the COVAX facility. There is no threat to Namibia's participation in the COVAX facility pending the payment of the upfront payment or the processing of the upfront payment. So we have received the official communication from the COVAX facility in this regard. So the processes are ongoing. And just to say that it is probably only 1 or 2, if any, of the countries that have actually made any upfront payment to date. So there is no threat to our participation, and the process is ongoing. We are working and exhausting our internal remedies to ensure that this is done correctly. As you will appreciate, the government has got systems related to procurement of items. And we have to make sure that even with this item where we need to make an upfront payment, the necessary procedures and processes are complied with, so that you don't find a situation where one day it is being said that we paid money for this vaccine and something was amiss. We don't want anything to go amiss. We want to make sure that everything that is being done, any payment that is being processed, is being done in a manner that complies with and satisfies our procurement provisions.
Yeah, please have a follow-up. Okay. I would also like to know, do we have any plans for Namibians to partake in the vaccine trials? And then maybe what are some of the conditions that we had to adhere to be able to partake in the vaccine, in COVAX? And lastly, when are we likely to make this 29 million payment, or the at most 29 million payment? Thank you.
Namibia is not participating in the trials, in any of the trials of any candidate vaccine. And as we say, the payment for the upfront payment to COVAX is being processed, and once that process is completed, the nation will be informed accordingly. But I cannot give you a specific date. It will depend on, as I say, the compliance with internal procedures related to payment for services.
Maybe, yeah. If they, from the Ministry of Health side, if there's anything you feel you would like to communicate at this stage that might not have been asked, that you really feel the public or the media need to know, that need to be communicated to the general public, please just go ahead and communicate that right now.
Again, we thank you for hosting this very useful platform. It enables us to communicate to the broader public through our media houses, and that is important. We are all here for the same purpose, and that is to make sure that COVID-19 pandemic in Namibia is brought under control so that we are able to open up more and protect the lives of the Namibian people, revitalize our economy, and safeguard the livelihoods of the Namibian people. The one issue that has been topical in recent days, of course, has been whether tourists may enter the country from the through the land borders. I just want to say that initially, and this is what the directive issued by the Minister of Health and Social Services under the Public and Environmental Health Act, following the lapse of the state of emergency, Tourism Revival Initiative initially indicated only 2 ports of entry, the Hosea Putabo International Airport and the Walvis Bay International Airport, but it further provided that other ports of entry, particularly the land borders, can be designated as port of entry for the Tourism Revival Initiative purposes. So up to yesterday, that was the status quo, that there were only 2 ports of entry for that purpose, and that was what the regulation provided for. But of course, discussions were ongoing to see whether other ports of entry then, because can be designated as such by the minister responsible for immigration to serve as ports of entry for tourism purposes. And I have just been updated now that the Minister of Home Affairs, Immigration, Safety and Security has issued a public notice to the effect that the land borders of Nord-Oever, Adamsvlei and Katima Mlilo will now serve as ports of entry for tourism. And this was done again, as it was stated that we were going to open our land borders on a reciprocal basis. And as you know, South Africa has opened their borders. So by principle of reciprocity, we are opening our borders at Adamsvlei and Nord-Oever. Zambia has opened their borders, and on principle of reciprocity, we are opening the Katima Mlilo border post. However, you will see that, for example, countries like Botswana, if they have not opened up their borders, we will not open the borders between Namibia and Botswana, or Namibia and Angola, for example, until such time that those countries also open, we consult with each other, and we decide that on that principle of reciprocity, we should be able to open. I think the notice by the Minister of Home Affairs, Immigration, Safety and Security, let me just see whether it makes provision for, yeah, I think also Walvis Bay border, the Walvis Bay port is also on the list as a port of entry for tourism purposes. So I wanted to bring that on the table because it has been topical. There has been a misreading of the law, actually, a misreading of the regulations initially, because there were some posts making round on social media that the Minister of Health and Social Services has unilaterally done away with the provisions of the regulation, but the regulation was clear that it was the two ports of entry, Oseaku-Takwa and Walvis Bay International Airport, and the land borders could only be declared as such, but they were not up to that point declared. So I wanted to bring that to the table just to provide some clarity. I thank you very much.
Thank you for that, Mr. Nangombe. I think I was also under the misapprehension and unclear about that. So what happens now in terms of if we now open up these specific entry points? What will be your ministry's response in terms of making sure that we don't import COVID-19 cases by road now, if tourists or people want to visit their families but come across as tourists, and I know some people really want to go and visit their families or come and visit their families on this side, especially from the South African side. So what happens now in terms of the ministry's response to these three border posts going forward over the next few days, next few weeks?
Our approach and the approach of the Tourism Revival Initiative was, of course, that tourists were not subjected to quarantine, and that tourists needed to proceed to a specific tourism establishment, and that they would be subjected to a test at a particular interval when they arrive. And that, in fact, before arrival, they are to produce a negative test to show that they are not infected by COVID-19. So with the opening of the land borders, of course, we expect greater numbers of people. That would mean that we need more human resources capacity. We need more resources in order to be able to handle the number of persons that are going to be coming into the country, in terms of tracing them, in terms of even now testing them, because we will still need the people to be tested after they have been in the country for, this is on the 5th day or the 7th day. So this means more work on the part of the Ministry of Health and Social Services particularly, and also other offices, ministries, and agencies. But it also means our people need to be more vigilant and to be honest in terms of indicating where they are going and why they are coming. So because without that, we may just see a situation where people come into the country, they are unaccounted for, and that could again give rise to cluster of new cases coming up and providing or making a setback for the gains that we have been making as witnessed in the declining number of cases. So going forward, we would count on full cooperation and full compliance of everybody that is coming into the country, also the involvement of law enforcement agencies, so that we actually, instead of, again, only relying on voluntary compliance, we need to make example of those people that violate our laws without, or rather unscrupulously violate our directives.
Thank you for that, Mr. Nangombe. The other thing was that, I don't know if you saw this, there was some disinformation about this online, that there was a contact tracing app being used. Of course, this isn't true. This referred to the Google and Apple contact tracing app that was being introduced in the US and parts of Europe. Wouldn't this be the point, given that with the borders opening, we should be expecting, as you said, an increase in cross-border traffic? Wouldn't this be the point where we would consider, given that we have, according to our telecommunication service providers, more than 100% cell phone coverage in this country, wouldn't this be the point where we consider introducing this sort of technology that would, I think, be easily introducible, given that this has already been tested in other places, and that Namibia would be a candidate ripe for trying to introduce something like this? Is this a consideration on the table?
Consideration, this is something that we have been looking at way before with UNAM, with NAST and other development cooperation partners. This is something that we are also looking at the options that have been put on the table through the African Union. I think, Naim, you attended the meeting where we discussed the platform that we want to introduce. Do you want to speak to that?
Thank you so much, Edie. Very correct. There are discussion of utilizing some of the electronic platform to make it easier for the travelers, so that wherever they go, the information is uploaded on the electronic platform from point A, to make it easier for them to pass through point B and point C. And that platform will also enable the Ministry of Health to access the information which is needed in terms of where is the travel on the day when they need to be swabbed. Just to make the movement a little bit easier, to account for who has arrived in the country in an effort to really prevent importation of new cases in the country, as the ED had just mentioned.
Thank you very much for that, Ms. Shibala. Yeah, so are there any other questions from anybody else? I'm not seeing any questions. So I think we can end it there, and I would like to ask that if we do have a need for an engagement like this, that yourself, Mr. Nangombe, and your team there kindly make yourselves available. We'll of course communicate well in advance, and just, I mean, some of these issues that have been raised here, some of the topics will probably be needing updating, and hopefully, you know, a month from now, we'll have more clarity on some of these issues. So if you would be, I would like to urge that if at some point over the next few weeks we come again with a request for you to sit down with us on a morning like this, that you please consider this favorably.
Creating this platform for us to communicate and exchange views and provide clarity to issues as they are raised. We are of course happy, time permitting, to make ourselves available to you on a platform like this in future. We have other platforms such as the COVID Media Center where issues also get discussed. But I just want to thank you again for the proactive way in which you reached out to us for us to exchange views on these issues. We highly appreciate it, and it is important for us for these messages to go out there so that the public is informed with correct, factual, objective information, and that is what we want. So thank you once again, and we will be available to you. We can bring additional experts in other fields depending on the subject matter to be discussed, and we'll always be happy to interact. So, thank you very much.
With that said, I think we will end the meeting there. I think there's a lot that has been said that can be transmitted to the public, that and some issues cleared up. I think especially the issues of the borders, and once again the issues around the vaccine and herd immunity and so forth. And I thank the health officials thank you very much for making the time again, once again.